A big part of my practice is breast reduction and breast lifting, sometimes done in conjunction with augmentation. But you've got to look, again, make a diagnosis of the problem and listen to the patient and find out what she would like to have done. And if the breast is too low and is on the tummy and doesn't have the right shape and maybe too large, we can use a lifting technique to put that breast back up on the chest, reshape it, and center the nipple over the breast mass. Now that's just a lift alone, and if there's extra volume, you will take volume out to make the breast smaller so they don't have the neck pain, the back pain, the bra strap grooves. That might be the procedure that is has the happiest patients afterwards.
The lifts?
The reductions,
oh, the
for
reductions,
sure,
okay.
Because they not only do they look better, but they feel better. They don't have that weight on their shoulders. You might be taking 2, 3, 4 pounds of weight off a patient that they carried around every day since they were teenagers. It is huge, and they can wear different bras. They can wear prettier bras. They can exercise that they couldn't do before because they were so big. And there's a lot of stigmata with breasts that are too big, and you have to hide them, and so you can't wear the kind of clothes you want to wear. You're not as comfortable at the beach or the pool when you're supposed to be in a bathing suit. Breast reduction is a wonderful operation.
Now, what are you doing to hide? I guess that's one of the fears.
The fear is about the incisions
or scarring.
But you know, the incisions heal great. It takes them a while to not get red, to lose their redness, but they all get white. The incision's hidden in the areola. So as the skin goes from pink or brown to white, the incision heals beautifully in there. And the incision underneath the breast you don't even see. So the incisions aren't a problem. For people who have large breasts, they don't care. With mastopexy, we'll evaluate the patient.
You mean lifts?
Lifts.
Is that what you're talking about?
Yeah,
okay.
Sorry, Randy, I used the doctor word. If they need to come up, we'll help them evaluate, because some people are low, but the procedure is more than they need. And then we try to use a smaller procedure. You know, there's a baby lift, a mama lift, and a daddy lift. And the daddy lift, of course, has the most power, but also has the most incisions. So if they don't need a full lift, we'll try to give them the minimal operation to achieve their goals. So if just the nipple's low, you do an incision around the nipple and it'll lift it up. If the nipple and the breast are low, but not, the nipple's looking at the floor, and believe it or not, that happens, we can use an incision around the nipple and down to the fold. And if the breasts are very low, then we use the incision around the nipple, down to the fold, and underneath the fold, and they all and
the results can be good, where they look natural.
Awesome. You know, it's better to have a pretty breast with incisions than a bad-looking breast without incisions.